Welcome back. When you're in pain and an MRI shows there are some problems, it's easy to get discouraged. That was true for our next guest, but she found out about a non-invasive treatment that gave her hope and relief from her pain. Joining us now is Stacy Roberts and Dr. Molly Olson from New You Health and Wellness. Rhonda is one of their patients, and she joins us now too to tell us about the pain-free formula that made all the difference. Good morning to you, ladies.
Good morning.
Good morning, Molly.
It's great to see you. All right, Rhonda, I want to start with you. What kind of everyday tasks were you having trouble with?
Nearly everything. I couldn't put on a jacket very well. I couldn't dry my hair and I'm predominantly right-handed, so there was very little I could do good, especially like anything with the rotating motion with my hand, like wiping down a countertop or a mirror or anything. It was just really painful. I had to get rotary tools to help me clean.
So tell us about those MRI results. Looking at them, knowing that there were rotator cuff tears, that you had some arthritis there, what were you thinking and feeling at that point?
Well, I thought I was going to have surgery, and my sister is a surgical tech, and she set me up for an appointment in Eau Claire with the surgeon. And I ended up chickening out because the more research I did, it's like a 50-50. You could end up better, you could end up worse. So rather than take the chance, I thought I would try something different.
Good for you. So tell us, after the first treatment and you started that, what was the first things that you noticed changing with your movement or with the pain?
It was immediate fix. I just was shocked. I had a very difficult time. I was told not to do too much, just to take it easy, but I felt so good. It was very hard to sit down.
Yeah.
So it was immediate results. I actually called some people that I know that are going through pain to tell them, because it was so miraculous for me.
That is so wonderful to hear. And I know you did 4 treatments along with some manual therapy. And look at these pictures. I mean, that we're showing right now, cleaning windows, reaching high overhead, even hammering. I wonder what it feels like for you to be able to do all of these things pain-free again.
It's marvelous. Absolutely marvelous. And I can sleep well at night. That was another major thing that was just very discouraging. Now I sleep very good through the night.
Yeah, and it's hard to heal if we can't sleep. So Dr. Olson and Stacy, tell us a little bit about this, because you combine SoftWave Therapy. I want you to tell us about that, along with some manual therapy too, right?
Go ahead, Molly.
Yeah, absolutely. SoftWave allows us to be able to do our manual therapy much more efficiently and effectively. So that's what helped mobilize Rhonda's arm and her shoulder, as well as her neck too, to be able to effectively do that reaching overhead motion pain-free.
And SoftWave then accelerates the healing. Like a condition like this would have taken, 12, 14, 16 visits without utilizing SoftWave and manual therapy in our functional exercise program. And now it's down to, somewhere between 3 and 6 after the evaluation. So it really is miraculous.
Yes.
Like you said. Yeah.
Unbelievable. And do you think it's that combination? Because the pain-free formula has those 3 components. It's the exercise that Rhonda was probably doing at home and in your office, but that manual therapy combined with SoftWave therapy. And I also want to know, did it hurt to have the SoftWave therapy, Rhonda?
Well, I would always say it's like a feel-good hurt, which is a strange way to say it. But I mean, I can feel the results, and I feel it going in deep, and it feels good to me, even though it kind of hurts.
Yeah.
SoftWave on its own, Molly, is really effective, but what we do is we look for the trigger for the pain. So we knew she had rotator cuff issues, we knew she had that arthritis, so we watched how she moved, we helped correct that, we give her those exercises, but then when we do the hands-on, that just enhances the improvement even further.
And can the improvement, Stacy, be long-lasting?
Absolutely. Absolutely. Some patients come back once a month if they feel like they want kind of a tune-up, but other patients we don't see for a year or 2 until they do something else, because this treats other parts of the body as well too. So it really depends on what that patient needs and wants.
Incredible, because so many people, I think, especially as we age, have shoulder issues. As you know, I do. Tiff's had those. And Stacey, really quickly before we go, what other areas of the body can you treat besides the shoulders?
So plantar fasciitis is a big one. Knee arthritis is another big one. Shoulder impingement, neck and upper trap pain, especially now that people are gardening, and lower back pain. So any type of musculoskeletal issue, if you're suffering from it, there's a really good chance that our pain-free formula program can help.
I love it. Dr. Olson, Rhonda, Stacy, thank you so much.
Thank you.
Thanks,
Thank
Molly.
you.
Good to see you.
Good
Good
see
to
you,
see
Molly.
you too. And Rhonda, it's so wonderful to hear that you're feeling so good and can do all those things now again, especially going into a warm weather season. And you
Thank
can
you.
contact, absolutely, you can contact New You Health and Wellness to learn about the pain-free formula and to see if you qualify for a $47 trial treatment. That's 70% off the normal price. The number is right there. It's 414-299-8121. Or for more information, visit newyouhealthandwellness.com.